right, this is the squat facing the wall, an excellent exercise for someone who fails the deep squat. The runner is about 4 inches from the wall, and they're slowly going down, feeling restrictions. They will loosen up over time. I'm looking at he keeps the abdomen engaged to keep a level pelvis, so he doesn't have increased lordosis in his low back. I'm also making sure he's not adducting his knees and losing arch integrity. An excellent exercise for increasing lower extremity mobility and thoracic extension. Thank you.
All right, and then the third exercise video is abdominal bracing and falling. This is done if someone fails the push-up test. So oftentimes that's a motor control issue. So we want them to feel what it feels like to be engaged in their midline. And this is a great way to teach it. Then we're using the pose concept of falling while they're engaged. Because it's one thing to engage in standing, and it's another thing to engage in dynamic movement. And the dynamic part of running is the falling part. So if we can teach them to fall while engaged in the midline, then over time with practice, that can transition into better midline stability during running. All right, so let's go and watch the video and we'll practice.
We're teaching abdominal bracing, deep core abdominal bracing for running in the sagittal plane. So what I'm going to have Paul do is squeeze your tush cheeks like he's holding a credit card. Do a slight abdominal draw in, and then slightly turn chest upward, just to make sure his head is centered over his hips. Okay, go to rest. All right, now we're going to do that while we fall, which is mimicking the running motion. What we're doing is we're just engaging core stabilization in the falling motion. So he engages his core, cheek squeeze, does a slight abdominal draw in, and then falls stiff like a tree falling in forest. So you can feel the engagement of the core being braced during the falling motion of running. And then he does it on one leg, which is actual running, falling while on one leg. So this is a great way to stimulate core stabilization in the sagittal plane if someone fails the FMS push-up test. Thank you.
A couple things. The subject there should have had his knee bent. Right? Running is a bent knee activity. So all falling, all bracing and falling activities, all single leg activities should be knee flexed. And the credit card thing is to get them to not maximally contract. Right? Maximal contraction is going to ultimately affect range of motion. We want bracing, not maximal contraction. So since a credit card is light, it's supposed to be a light cheek squeeze and a slight, maybe 10 or 15% of max abdominal draw in. That's all it takes to activate deep stabilizers. And patients understand that language as opposed to telling them to activate transverse abdominis. Okay. All right, so we're going to practice, and here's how it's going to happen. We're going to get into groups of 5, and we'll have 1 or 2 practice or demonstrate in the groups, the test, and the rest of you can kind of group assess. We'll have about 5 minutes or so for every 2 tests. So I'll tell you which 2 we're doing. And in those 5 minutes, make sure your group practices both. And in the first 5 minutes, we're going to do the deep squat. And we'll fake like we have a dowel, so it's good enough. And we'll do the squat facing the wall. So the exercise and the test line up. And if you're kind of in the left half of the room, then we'll do the deep squat first, just so we're not all crowding the walls. And if you're in the right half of the room, we can do the squat facing the wall. We learned earlier, that this wall kind of moves. Yeah, we were thinking y'all were thinking we were having a party over there with the wall shaking.
Eric, I was standing against the wall and banging against me and pushing me so I had to move. So I was leaning like he was leaning, and you guys stepped in. What the heck are they doing?
I tell you, it's all fun. It's all fun. You all are going to get to experience it now, so brace yourselves. So, we got the rest of the wall, and it's not going to fall over, I don't think, but use your own risk. Yes?
Shoes off for the squat test?
Yes. Yes.
Lunge test too?
Yep, definitely. Yeah, all of them. All right, so 5 minutes for those 2 tests. And listen for me saying the 5 minutes are up so I can tell you the next 2 we're going to do. Let's go ahead and begin. Let's do it. I'll float around and help. Grab your hand out for help.